This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Morning, and thank you, Corey. Uh, we want to talk to you about the recent recommendation coming from the CDC and the FDA. As you know, yesterday, the CDC Advisory Committee on Immunization Practices met to issue its guidelines for administering booster doses of Pfizer to certain populations. Earlier this morning, the CDC director endorsed those recommendations and also recommended a booster dose for people who work on high-risk occupational and institutional settings. Those recommendations from the CDC are aligned with the recent recommendations received from the FDA. The CDC is recommending the following group receive a booster dose at least 6 months after the second dose. Those are people who are 65 years and older and residents in long-term care facilities. Also, people who are 50 to 64 years old with underlying medical conditions. Similarly, people who are 18 to 49 years old with underlying medical conditions may receive a booster. And then people who are 18 to 64 years old and they are working at places or institutions where there is a high risk of exposure and transmission of COVID. It's important to emphasize that all those recommendations are specifically for people who receive the Pfizer vaccine. So those recommendations that today are not for people who receive the Johnson & Johnson or Moderna vaccine, because the CDC and FDA have not yet received the studies supporting similar recommendations. There are groups working on that information. Once the information is available for the federal agencies, they will make the recommendation. I also want to mention that we, Southern Nevada Health District and our community partners, we have COVID vaccination clinics located across the county. Actually, we have 15 locations in the county. 12 of them are right now open. 3 others are functional and just waiting for our direction to open. And of course, we are waiting for the state direction on when to start with the booster vaccination as recommended by the CDC. I also want to emphasize that even so we are getting into this incorporation of the booster vaccine, still our primary goal today is to expand the vaccination to those who are not yet vaccinated. That's our primary goal, and we will still keep working on that. And also, we want to say that even so, the federal government is offering those booster vaccines. Still, those vaccines are considered highly effective. The main target of those vaccines is actually prevent severity and death, and this is something that all 3 vaccines have been shown to be highly effective. We encourage any person in Clark County who has not been vaccinated yet to please go to any of our vaccination centers or the local pharmacies and ask for the vaccine. It's very important for us. As many of you know, in Clark County, more than 85% of the people who are being diagnosed with COVID or being admitted because of COVID or die because of COVID are people who have not received a single dose of vaccination. I will stop here now, and Corey, we will open for questions.
At this time, we will take one question from each member of the media. If anyone wishes to ask one, of course, please raise your hand using the raise hand feature. If you're on the computer, you can find that feature at the bottom of the participants list. But if you're just calling in, please press *9. At this time, our first question comes from Mary Hines.
Good morning. So once you have the go-ahead from the state to be giving the third doses, will an 18-year-old casino worker or grocery store clerk be able to get a third dose? And is anybody going to be required to prove that they qualify?
Okay. Joanne, you want to take that or?
Or sure. So the guidelines say if you are in a increased risk of exposure and transmission because of occupational or institutional setting, we're still going to receive guidance about that issue from the state. So that's what we're waiting for, is a little more clarity on that type of what that exactly means. The individual will look at their own benefits and risk, and of course that will weigh in on that as well. As far as proving that at sites, we have not yet determined what we will do so far. Like we did for immunocompromised, we just had them self-attest that they had a medical condition, and we'll do that with underlying health conditions as well.
Thank you, Joanne. As we go through the questions for everyone, please be sure to identify yourself and the media outlet you work with, please. Jacqueline Schultz, you are next. Please go ahead, Jack. Oh, there you are.
Thank you. Hi, folks. Jacqueline with Fox 5. Would you be able to tell us how many people we think might need a booster? How many people we're talking about here? And how important is it to speak to your doctor about whether you need a booster?
Okay. Well, I will start. I don't have the numbers in front of me. I don't know if Joanne or Sarah have those numbers, but we do have the number of people vaccinated through the different priority groups that were decided at the beginning of the vaccination campaign. And those numbers will guide us on actually the planning of these phases of the campaign. I don't remember the second part of the question. What was?
The talking to your doctor.
Correct. In terms of determining who should and who's really at risk and who's high risk.
Okay. Okay, Corey, you want to talk about that, please? You're mute.
You're muted, Dr. Love.
Okay, great. They just unmuted me. Great. Thank you for that. I'm sorry, can you please repeat the question?
About the people who might want to be vaccinated, you know, why should they talk to the doctor? What they should talk to the doctor about?
Yeah, certainly. So the guidance we got so far, specifically related to folks with underlying conditions, is that those underlying conditions are fairly extensive, and CDC has listed those conditions on their website, and we will certainly make that information available to the public. But certainly, if folks have questions about whether or not their health conditions or underlying health conditions qualifies them for a booster dose, or if they have questions about the need for a booster dose, then certainly we recommend they talk to their individual provider about that.
Our next question today is from Caitlin Newberg.
Hi, everyone. This is Caitlin with the Review Journal. The health district's data website is showing that case averages and the averages for deaths have been decreasing in recent weeks. Is it safe to say that the peak we saw over the summer has ended? And how significant have vaccinations been in decreasing the metrics?
Sure, thank you. Yes, actually, if you look at the chart in our website, you could see that the trend of COVID in Clark County is really decreasing since probably about 4 or 5 weeks ago, and of course also when you look at the positivity rate, 7-day positivity rate of COVID testing in Clark County, that trend is also decreasing. Our positivity rate about 5 weeks ago was 18%. Today, that positivity rate is 8.2, 8.3%. So what it means is that there is a decrease in COVID transmission in our community. And of course, that also translates on the proportion of people who are vaccinated who could actually develop the disease as a breakthrough cases. The higher the transmission level in the community, the higher risk of people, even if they are fully vaccinated, to develop the disease. I mentioned before, what we have seen in Clark County so far is that about 15% of the cases that are reported are fully vaccinated. That's the trend that we have seen. Initially, in June, it was about 3 to 5% when we started with the increase in the surge on cases. But as that wave went up, the proportion of vaccinated cases also went up. But right now, as we can see, a decrease in the transmission level in Clark County, that have been kind of level off about 15 to 18% of the cases being fully vaccinated, which again is not unexpected. When we look at those numbers, really, we see that again, mortality, hospitalization in among people who are fully vaccinated is almost norm. I believe we have in Clark County 1 death per more than 10,000 vaccinated people, which is about 40 times less than what you see in unvaccinated people. And the same when you look at the incidence of the reporting of new cases, we are seeing about 70 to 80 fully vaccinated people who actually are infected per 10,000 people. So the numbers are really small and are really confirming how effective the vaccine is still here. Thank you.
Our next question today is from Jeff Gillen.
Good morning, everybody. Jeff Gillen here, Channel 3 News. This is to Dr. Leguen or to anyone else on the panel here. How exactly do you foresee this campaign, this booster campaign, rolling out? Are you just going to be using now the existing assets, the pharmacies, the doctors' offices, or do you expect to, as we saw earlier in the vaccination campaign, do any sort of large sites for boosters? How actually do you plan to roll this out?
Yeah, Joanne, Sarah?
Yeah, go ahead, Sarah, on this one. She's got this down pat.
Thanks for asking. So at this time with our static sites that we have up, it's exactly what we're looking at, is that in addition to the pharmacies and the grocery stores and the Targets and the other stores that have it, or the doctor's offices that have it, we have 12 static sites that are already up that has an untapped capacity of what we're getting at. Right now we have about 20% of the capacity being filled with people getting vaccinated. So we have room for more people to come with this additional dose, and the booster doses coming. In addition, we also have the ability, we're positioned to be able to scale up quickly if it's needed.
So everyone will be getting their vaccine wherever they got their first or second dose. You don't necessarily have to go back to that provider. That has changed since people got vaccines back in January and February. Right now, you can get that dose anywhere. So any pharmacy, any of our sites. We just revised our web page so that you can put in your zip code and you can go right to whatever is in your neighborhood or wherever your workplace is. So we really encourage the public to really take advantage of that.
If any member of the media who has not yet asked a question but wants to, please raise your hand. Remember, the raised hand feature is at the bottom of the participants list, or if you're on the phone, hit *9. We are going to take a follow-up question from Mary at this time.
Thank you. What is your best estimate then in terms of when people will be able to get the third shot? If someone went to one of your clinics today, could they get a third shot? Is your best estimate sometime next week? People are champing at the bit to get this third shot.
They sure are. So for our clinic specifically, we are probably going to wait till like later next week, but they could try to access that at the pharmacies or other sites as well. All of the providers have their own systems in place and their own ways of getting that in place. But I know a lot of people will probably be waiting for that state guidance.
This is Jennifer. Can we provide some clarification about the third doses versus the boosters for people as well?
Right. So we're talking about a booster dose. And so that means that someone has received the primary series, as we say, so the first and second dose, and this is a booster dose 6 months after the second one. So this is different than the one that is called an additional dose for immunocompromised people. If you recall, in August, that was recommended 28 days after the second dose. And that's part of the series. It's to make sure that those people whose immune systems aren't working real well, that they get another dose to kind of get that immune system going. So the booster dose is after the immunity wanes, and then we boost it and bring those antibodies back up. Does that help? Yeah.
And those are currently available in our clinics.
The ones for the immunocompromised, yes, absolutely. We've been doing that for almost a month.
Thank you, Joanne. Let's take one follow-up from Jeff and then any closing comments from the panelists before we move on to the Spanish section. Jeff, one last question, please.
Yes, thank you again. Let's talk about supplies, since now booster shots are going to be, people will want booster shots. How's the supply of vaccine? Do you have enough? Any concerns, or that's not really an issue at this point?
Yeah, right now it's not been an issue. We haven't had supply issues for a while. In the beginning, they were just getting the manufacturing up. So we did have a lot of, limitations with that, but not at this time. The type of vaccine There's been some issues with Johnson & Johnson, but we still have enough supply for anybody that wants their first dose, second dose, or subsequent doses.
Thank you, Joanne. Does anyone else on the panel have any closing remarks before we end the English portion of this briefing?
Well, thank you, Corey. Again, I just want to emphasize that our primary target today still is the people who have not received any dose of the vaccine. That's the unvaccinated people. That's the people that we are really looking at today. But the booster doses that we'll be offering very soon, hopefully starting next week, are very important as well. But it doesn't mean that the vaccine is not effective. We know that the vaccine is very effective, especially in terms of preventing hospitalization and death. And there is a lot of data already supporting that. So I just wanted to make that comment. Thank you.
Thank you, Joanne and Sarah and Dr. Loaf. That wraps up the English portion of this briefing. Dr. Loaf, again, if you could please give your Spanish introduction, then we'll move on. We've got a couple.
You've been watching breaking news from the Las Vegas Review Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.